It's one of our favorite times of the week. Time for another edition of Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic in Spirit Lake. Good morning, Dr. Meyer.
Good morning, Dave. Good morning, everybody. Good to be here.
Well, you are just crazy busy. You keep getting busier. And last night was one of those occasions, yesterday was, as you unveiled TruDOSE Platelet IV Therapy. We talked about it a bit last week with Elena Herning.
Yes, we had a great crew last night that came to learn more. Of course, we flew Elena up from Dallas, Texas, where she said it was 90 degrees, to the cold and wind of Iowa, but she said it was a nice change of pace. And she brought with us some incredible information and training. We're always looking at identifying things, tools in the tool belt we always talk about, Dave, things that are major players that are pillars that help create a healing response in the body. And so over the years, we've identified some of those things as ozone therapy, hyperbarics. Of course, you can't forget just the lifestyle changes, what we're eating, what we're not eating. And so TruDOSE PRP is, I believe, going to be one of those pillars. Mm-hmm. And so it's so exciting to have that because, as Elena will share, I'd like her to share a little bit of her story. When you get to a point where you've been spinning your wheels and you're not doing the personal healing that you hope to do yourself, that you start to lose hope. And that's the thing that I have learned over the course of the last 3 to 4 years is there is always hope. There are so many treatment tools, avenues, practitioners, health healers out there that want to get you on the right path. So make sure that you're expecting that and don't lose that, because that is going to be a critical piece of working with you on this healing journey. But in particular, TruDOSE, how it's different from traditional PRP, which platelet-rich plasma. So these are typically platelets we think of as clotting if you've got a cut, something along those lines. But they activate a healing response when they are introduced in the right way at the right dose. And that healing response can be absolutely dramatic for individuals. And there's not many chronic conditions that this treatment, it's an IV treatment where we take a little bit of blood out of the finger or out of the arm, and we introduce it into a machine that is going to help determine the best dose to activate this healing response for you. So, and then we end up giving a very small amount back to the individual of these platelets, and this is done, could be every 6 to 8 weeks over a series of anywhere from typically, in most cases, 5 to 6 treatments, that the healing response starts. And Dave, I told you I had my first one yesterday, and last night I slept like an absolute dream. I don't think I've felt as relaxed, because what I've been through in the last 3 to 4 years, it's been quite a journey. I've carried a lot of stress, and you sometimes don't realize you carry that until you feel it melting away. And getting that body out of the fight or flight state, which that's what it did for me yesterday with my treatment. It was a reset for me, and I'm really, really excited for my journey with it, let alone all the other people that are going to be coming into our clinic here and are going to get to experience this. Again, it's a tool used as part of a symphony of tools. So we have a lot of different instruments in the band, and we have to be addressing all these things. And many times together, then you're able to create some incredible music. So, yeah, it was an incredible feeling, and I want that for everybody that comes into our clinic. But I've got Elena here, mm-hmm. and she has just got an incredible story herself, where 30 to 40 years she was in search of feeling better. Mm-hmm. And to the point where she had her son had to help her around in a wheelchair Mold was a major impact for her, horrible fatigue and brain fog, but I don't want I want her to share a little bit of her story, and it's just a gift. We're really grateful to have her here to help. We always talk about planting seeds and starting things in different parts of the country where she goes to have these little areas of hope in healing, introducing these approaches, because so many people need healing, so many people need to feel better, and so that's what we're doing here, and that's why we brought Elena. So here she is.
All right. So
good morning.
Hi, Elena. Nice to visit with you again. So if you would be kind enough, just share your story with us again of how hopeless went to hopeful and thriving.
Right. So I found TruDOSE about 3.5 years ago. And when I found it, I had been battling chronic Lyme for over, 20 years, systemic mast cells since I can trace that back to about being 15, POTS syndrome, mold illness, something that mimics MS called MOG, all the viruses, all the co-infections that come with Lyme. And, I had an incredible doctor who was able to get me to a certain place. And that place was great, but my monthly spend on supplements was about $1,200 alone.
Wow.
And I was always in one appointment after the next, just trying to stay above water. And so TruDOSE was introduced to me in a clinic in Colorado, and I was pretty resistant for the first couple months. I just kept saying, just fix my neck. And then I finally gave in. I was connected directly with the founder, Tapley Holland, and I ended up flying to Texas to have my first treatment. My results shifted so quickly that by week 3, I was about 80% out of pain, and I suffered from bone pain, nerve pain, you name it, pain. They actually wanted me on fentanyl patches at one point. And then the brain fog lifted. My ability to have a conversation shifted, and it just continued to increase. Now, I was a patient who had been on the FODMAP diet for 2 years. I was really prepped and primed for this, not knowing that was the case. And I went cold turkey off all my supplements, which were about 50 a day. And
Wow.
I have not, in the 3.5 years, I've not needed to really go back on them. Mm-hmm. I've been dealing with one last lingering co-infection. But at this point, I no longer have Hashimoto's. I no longer have Lyme bands. I am not as susceptible to mold. I don't live in it, and I don't stay in it, but I can be around it without it sending me to bed for, 6+ months.
Mm.
My mast cell, I no longer need EpiPens, and I have not had a flare in 3.5 years. And POTS, I've had one tachycardia episode since. And that is kind of a recap of all my laundry list of things. And, being here is so incredible. This clinic is amazing. And for me, coming into these situations as from the patient's perspective and have been a patient, and I, was almost killed by the doctor 3 times. So when I get to experience providers like the providers at
Okoboji
Wellness Clinic, it never loses that magic.
Mm-hmm.
What happened here yesterday, treating the patients, was amazing. Everybody had an incredible result, and when you are able to give the body what it needs, it's like the body recognizes hope for the first time.
Yeah.
And it's something that we experienced here yesterday with, I don't know, 6 patients or so. And you can feel the energy in the room. You could feel it shift. You could feel that hope in everybody who left the building. So my job with TruDOSE is pretty extraordinary, and being able to bring it here is amazing.
Awesome.
And that's kind of my story.
Thank you for sharing that with us, Elena. Elena Herning with TruDOSE. And again, Elena was at Okoboji Wellness Clinic yesterday, had their educational event last night, will be there today as well. Dr. Meyer, when both you and Elena were her story is incredible. I can't believe $1,200 a month on supplements. That's just amazing. But I got to thinking while you were talking about when we feel hopeless, like, man, why can't anybody help me? And again, now you're putting another tool in the tool belt, because people are craving to not just survive, but, as you like to say, thrive.
Absolutely. And what I like about this, we talked a bit about this last night, about this treatment, is it gives the body a little nudge, and it's different than hyperbarics and ozone, but it's similar in some ways, in the sense that you're introducing something to the body that the body really needs and enjoys and likes. So in the case of ozone, free oxygen molecules. In the case of hyperbarics, more oxygen, pressure, which is another huge component with hyperbaric therapy. But the body we were just perfectly created. Our body, when you introduce some of these specific treatments, knows what to do with it. It knows, I'm gonna push the gas here a little bit, or I'm gonna tap that brake a little bit when you introduce particular types of therapies. And so sometimes as practitioners, as physicians, providers, whether it's a supplement or it's a prescription, we're down at the end of the road many times, focused in one area, and it's going to have a whole downstream cascade effect by me prescribing a medication, or by being on a multitude of supplements. Again, there's a time and a place, as we always talk about, for prescriptions, and supplements are great, absolutely. But what I love about TruDOSE in particular, again, is it's giving the exact dose for the individual. That's when folks come into the clinic here, and hopefully every really good clinic, well-intentioned clinic, is that we're looking at that person in front of us as a unique individual, and not just saying one size fits all. And that's when you give the TruDOSE, it's a specific dose that the body is then able to activate the immune response, and that platelet, as Elena talked about last night, is hanging out in the healing process for 6 to 8 weeks after that treatment, and activating. It's finding where it needs to go. In many cases, it starts up in the brain and works its way south and into the lungs. And our platelets, as she said, are made in the spleen and in the lungs. But it's going to find the areas where it needs to go first, most urgently, to help restore the body in that regenerative repair mode. And then over time, it kind of works. We always talk, Dave, about the layers of the onion. It's doing something like that. It's just finding those different layers and the different. Oh, we're going to work over here next. We're going to work over here next, and it takes. It's the beauty is it takes some of there is some discretion by the physician, the provider, to say, okay, well, we every time that you come in, we want to, do we need to change and pivot the protocol a little bit? But in general, we introduce this great, perfect TruDOSE for the individual, and it's a tiny amount that's reintroduced after we centrifuge it, and which is spinning it, and then the body just knows what to do with it. After you've taken those platelets out and reintroduced them, it's like they're seeing your body they've got a memory, but they see your body for the first time, and they're like, ooh, I'm going to go over here. I'm going to go over here. And this is where you might see somebody that has had neuropathy, for instance, for years, and after one treatment, we had an individual yesterday that already had a response with neuropathy. Again, neuropathy is the nerves aren't firing right. Many times it's a burning sensation, uncomfortable. A lot of times it's in the feet, can keep people up at night. A lot of times it's noted with diabetes. There's so many other causes of neuropathy. But what an amazing response that individual had to have this, and this gentleman's been dealing for over 3 years with this.
Wow.
3 to 5 years, I believe. And so it's just a beautiful thing to see and be a part of, and that's what we're trying to do. We're trying to find the best of the best treatments that are out there, expand the envelope, and as I say, God has made us perfectly, and our bodies want to heal. If we just get our bodies in the right space and in the right environment and with some of the right tools, there's a lot of magic that can happen.
Absolutely. All right, we got to get out of here. Elena, thank you so much. Dr. Meyer, thank you. Now, Dr. Meyer, folks want to have that first appointment with you. Maybe they want to go ahead and have that 15-minute appointment where they tell you about their particular story, or maybe they want to come over and see you, just set up an appointment, whatever the case might be. What's the best way to get a hold of Okoboji Wellness Clinic?
712-339-6024. You can find us online at OkobojiWellnessClinic.com. And we're off Highway 71, 3305 Berquist Avenue in Spirit Lake. Yes, we do those complimentary discovery calls to make sure that we're a good fit for the journey at the time, and get a little bit of your history there. Those are complimentary. If you are interested in starting with the TruDOSE, then and you have not yet established care with us, then we'd want to have you make a visit with us so we can start that journey as well and see what the process is going to look like for you and TruDOSE. Exciting times, and we're grateful for all the open-minded folks out there that are expecting more for themselves. So again, we want to thrive, not just survive, right, Dave?
Absolutely. And some of these stories that I hear, especially from somebody like Elena, boy, I try to put myself in their shoes and think of how I would have felt, and the hopelessness has to be huge, and to get to a point where you see all that illness in the rearview mirror has got to be an incredible feeling.
Absolutely incredible, and it's a constant journey that we're on, because as we talk about, Dave, we are the exposure to the toxins doesn't stop.
Yeah.
There's a lot out there, but again, there's a lot of hope, and if the individual is ready to put in the work and they're ready, then yeah, absolutely. It's so good to be in that space where you're feeling well again.
Absolutely. All right, got to go. Dr. Meyer, Elena, thank you both so much. Have a great day. We'll chat again soon.
Have a great day. Be well.
Dr. Bradley Meyer at Okoboji Wellness Clinic. You can find out more at OkobojiWellnessClinic.com. Some of these hope stories that are shared, just incredible.